Bismillah ar-Rahman ar-Rahim. Hantavirus pulmonary syndrome. It is also known as hantavirus cardiopulmonary syndrome, caused by single-stranded involved RNA hantaviruses, first described following an outbreak in the SWUSA in the 1993. There are several different hantaviruses has been associated with this syndrome. Previously described hantavirus-associated diseases occur more commonly in the Scandinavia and northeastern Asia and tend to cause hemorrhagic fever and renal failure with relative varying or relative sparing of the lung. Very rare and affected individuals are almost exclusively from America, particularly from the Four Corners region of United States of America, where Arizona, Colorado, Utah, and New Mexico meet. Disease develops following inhalation of aerosolized viruses from rodent feces, urine, saliva, and typically affects previously well young adults. Common presenting symptoms are fever, chills, cough, myalgia, and GI symptoms such as vomiting and abdominal pain. Restlessness occurs later in the disease course and is often quickly followed by respiratory failure and the development of acute respiratory distress syndrome. Shock may occur and is associated with a poor prognosis. Lab testing classically reveals neutrophilia, thrombocytopenia, and elevated lactate dehydrogenase, and sometimes renal impairment and mildly abnormal liver function tests. Leukocytosis and immunoblasts in the peripheral blood are associated with severe disease. Chest X-ray typically shows initially bilateral basal infiltrates that progresses to involve all regions of the lung. A minority of cases are normal. The diagnosis may be confirmed using serology, PCR for the virus, or by detection of the viral antigen using immunochemistry. Treatment of the hantavirus pulmonary syndrome is supportive within an ICU, including the use of extracorporeal membrane oxygenation when appropriate. It is unclear if the person-to-person transmission occurs, and patients should be in respiratory isolation. Intravenous ribavirin may be administered, although this has not been demonstrated to improve outcomes. Mortality of hantavirus infection is 10 to 50%, with deaths usually occurring within several days of presentation.